I've been a GP for quite a long time now, and it does get easier as you get wiser, older, and more experienced. It's still true that it's a challenging job. The intensity of workload makes it difficult to make decisions because we make them very fast and about serious things.
People are living longer, have more long-term conditions, and all the services that we want to refer patients to are on their knees from the backlog from COVID. It's much harder to get someone seen in hospital at all, and the waiting lists are really long. But it means that you're holding patients for a long time with conditions you really need help with.
Thomas George?
Mm-hmm.
Hello, I'm Dr. Whelans. Come on in.
Right.
Come on in and take a seat. What did you want to talk about today, Mr. George?
I've got a pain here.
Okay.
It's absolute murder.
And when did the pain start?
About a week ago.
Okay. And had you been doing anything at the time that might have caused the pain to come on?
No, nothing more than a bag of shopping.
Okay. And how have you been feeling in yourself over the last week?
Depressed.
Is that because of the pain?
Because of the pain.
Okay, fair enough. Any problems with your breathing?
No, the only thing I notice is if I breathe in deep, it does pull on this.
It hurts here?
Yeah.
And have you had a cough at all?
No, not to speak of.
No. And what have you been taking for painkillers?
I took some aspirins, but they didn't seem to be working. And then I looked at the sell-by date, and it was about 10 years past the tube.
So they're probably not going to do that.
So I found some ibuprofen, and they were still in date, I think. So,
sure. And did they help?
And they helped a bit, yeah.
Okay. What we'll do is we'll have a look at your chest. It might be best if you take your jacket off and take your jumper off for me as well.
Fine.
Is that okay?
Yeah. No, I'm bothered whether people see me. Well, I lived 10 years on a yacht.
Oh, did you?
And all I wore was a pair of trunks or a pair of shorts.
So were you very fit when you were?
I was fairly fit, yeah. I could climb the mast.
I'm just gonna lift your jumper up if that's all right. And then can you show me where the pain is?
Yeah, it's right in there.
Ah, yes.
Comes down
round here.
There, yeah.
Okay, I'm just going to have a little listen to your chest. So some deep breaths for me. Lovely. And take a seat for me.
So, which finger?
That one will do. There we go.
Does it sound
Lovely.
big?
No, it says nice and normal. This is shingles, Mr. George.
Is it?
Do you know what shingles is?
Yeah, I think my mum had it.
So when you have chicken pox, what happens after you've had the chicken pox is it goes and lives in your nerve root. Yeah. So you carry that chicken pox around with you, and then at some point in the future, that the chicken pox just comes out and causes infection again. If we'd have seen you straight away, we could have given you some antiviral medication, but I think it's probably too late for that to make any difference now. If you feel like the pain is manageable, I'm hoping from here it should get better. But it's just getting you through this period where you're waiting for your body to fight off the infection. Does that make sense?
I think I need something to take this sort of pain off. It's just driving me mad.
Fine. So usually I would give a medication called cocodamol. Have you had that before?
Who?
A medication called cocodamol.
I think I have.
It's got paracetamol and codeine in it.
Yeah.
And I'm hoping that this pain's going to settle down over the next few weeks.
Me too.
Now, the thing you need to know about shingles is that people that haven't had chicken pox can catch chicken pox from you whilst you've got the shingles. So is there anyone in your family that's pregnant at the moment?
No, I live on my own now.
Okay.
Everybody else is gone.
All right.
Right, yeah.
Great. Lovely. Nice to meet you. Do you need an arm there? You're all right?
Yeah,
you've got it.
Just getting the balance and...
no climbing the mast today.
No climbing the mast, no. The worst one's throwing the anchor when it's wedged.
It sounds like a wonderful life. Do you miss it?
Does, yeah, I do.
I bet you do.
Yeah.
Right, nice to meet you. Look after yourself.
Hello there. Do you want to take a seat for me?
Posh in here, isn't it?
It's very posh, yeah. The doctor will see you in a minute.
Okay. When I first walked in, I thought it was like a tanning salon or them massage place.
No, it's not a massage place.
No, when you walk in, you would think, wouldn't you?
Yeah, it's a doctor's surgery.
How very posh it is.
It's very posh.
Oh, you got the big timer.
We've got an egg timer as well. I'm just going to turn it over.
How long is that then?
A couple of hours.
Whoa.
Hi,
This afternoon.
Lee.
Hi, the doctor's
Hello,
ready.
it's Dr. Gray. Come on
Okay.
in.
Oh, let's get everyone done then.
Come and have a seat there. How can I help today?
I think I got a chest infection.
What symptoms do you have?
Well, didn't you just hear me cough?
Yeah.
One of them. I had it come about Tuesday. I had that cough and runny nose. Runny nose not so bad now. It's, I get the cough. Best to mention I'm still smoking with the cough, so that I don't know if that's going to make it worse.
Yeah, will do. What do you smoke? Okay.
But I can't just stop smoking because I've got a chest infection. I'm addicted to vaping, you know what I mean?
Yeah. Have you done a COVID test at all?
Yeah, and that was clear.
That's negative. And have you had the vaccinations for COVID as
I've
well?
had the three.
The three. Have you felt feverish, kind of hot and cold at all?
Well, it is quite cold outside,
Yeah.
isn't it? So I've been feeling cold, but I don't know if that's because it's cold outside or
Okay. And how are you in your general health?
I've lost weight.
How is your diet?
The thing is, sometimes I don't eat because I can't be bothered. It's not because I'm anorexic, I just can't be bothered to eat.
And who do you live with? Do you live with your
Mum
own?
and Mum and her husband and my dog and the fish.
And if they prepare food,
Yeah, and I
will
eat
you
it.
eat it? Okay.
Once a day, but people say once a day is not enough.
And do you drink any alcohol at all?
Every week, Friday, Saturday, and then in the week I don't really.
And at the weekends, how much would you drink?
Oh, I ain't being nasty, but that's a ridiculous question. I can't even answer that.
Okay.
I mean, I could probably say a bottle and a half, and you would be like, well, I don't know what that is.
Yeah. What do you? Is it beer or spirits? Or?
Spirits
Okay.
mainly, and a couple of ciders as well. So.
And would that be a bottle and a half of spirits over a weekend?
More like one night.
That's a lot.
Do you drink alcohol?
2 or 3 pints on a Friday night, something like
That's
that.
fine.
I can have a pint
Yeah.
for 2 halves, or I can eat, but I can't have a pint and eat.
No more than half a bottle of wine per week.
Not too much.
When I'm on holidays, yes, I like drinking.
So which is it then, a pint or the eating?
Like yesterday, I went with my brother-in-law, we had a pint,
Yeah.
and then last evening I was eating, so just take it easy.
Yeah.
What are we talking about? Red wine was?
A lot of wine.
Okay.
I have a glass of Jack Daniels and Stones every night at 10 o'clock.
Yeah.
Not before,
Yeah.
you know what I mean?
Yeah.
10 o'clock.
But the wine, drink not more than, not alcoholically more, just drink a few.
Okay, right.
Do you worry about your drinking at all?
No, you know, you don't drink with your friend, you feel left out if you're drinking and you're not, you know.
Yeah. I wonder if he's drinking because you're drinking.
Well, he's the one that pours the drinks.
I mean, if it's something that you want to come back another time to talk about, we can certainly
No,
support
it's
you in cutting down if that's something that you want to do.
It's fine.
The recommended amount that's sort of good for your health, it's more like 14 or 21 units a week, which is more like half a bottle of wine or a bottle of wine across a whole week.
But we don't
rather than
do
short
wine.
wine.
I mean, wine is disgusting. That's more for posh
Yeah.
people.
Okay.
But we don't drink it like pop. We pour like say a single or a double, and then top it up with Coke. It's not like we're drinking it straight.
Yeah. It's still the amount, so if in the spirits, for example, if in one shot you've got a couple of units there, then really across a whole week you don't want to be drinking more than 7 to 10 shots across a whole week.
No, we drink on a Friday, on a Saturday, sometimes just a Friday, and then Monday, Tuesday, Wednesday, Thursday, I'd completely off it.
And it is really good to give yourself a break from any alcohol at all, so that
and this
definitely
week
will be
I got a
helping.
chest infection, I think.
Yeah. Let's have a look at you with regards to your chest infection. So this.
Yeah, I've had
Yeah.
one before.
Do you mind if I pop that on your finger?
Anything that's fine, innit?
Thank you. Oxygen level's good, 100%. Can't get better than that. Your pulse is okay at 82. I'm going to check your temperature because you weren't sure if you felt feverish.
Whoa. You're not putting that in my ear.
Oh,
I
no.
think about my ears.
Okay, where can we put it?
What other holes do you use?
That's a good point. This particular one is for ears. Do you want to come up here for me and just sit on the edge? And I'm just going to pull the curtain round so that I can examine your chest, if that's okay. All right, deep breaths in and out for me.
It's in my throat already.
Okay. And then come and sit down, and we'll talk about next steps.
Is it a chest infection?
Yeah.
It is.
So I do think it is a chest infection. Have a sit down. When I listened to your chest with my stethoscope, there was a part of your lungs that made a crackling sound when you breathed in, which suggests that you've got a chest infection.
Oh.
So actually, I think you need antibiotics. And on that basis, I don't think we need to find another way of checking your temperature, because it's not going to change my plan.
How long do I need to take it?
5 days. So it'll be morning, lunchtime and evening, so 3 times a day for 5 days.
That's the problem. Why don't I get up till 12 o'clock?
So you can start 12 o'clock, late afternoon, and then before bed.
That's fine.
What I'll do is I'll send the prescription electronically to the chemist. Do you want to use the one just here that you can
I get
pick
the
up
stuff
straight
today?
away? You can get it today? Yeah, absolutely.
Should this clear up by next weekend? Because I really want to drink next weekend.
Yeah, it should clear up by next weekend. I do recommend not drinking too much when you're on the antibiotics, because it will just make them less effective. And actually, most people, when they've got a chest infection, they feel
5 days.
Want to.
It'll be finished by then.
Yeah, you should be fine by next weekend from a chest infection point of view. I hope you feel a lot better once these antibiotics get into you.
I just want to get this out the way, and then I can just get back to what I was doing.
Absolutely. All right.
I mean, chest infections are one of the worst things you can have. Apparently, is that true, can turn into pneumonia?
Yeah, it can.
Well, how do I prevent that from happening then?
Yeah, mostly by resting up, taking your antibiotics, and
I'm playing
just
video
looking after your
games
health.
all day, so is that how?
That's pretty restful.
I'm only using my arms and all. All right, thank you.
All right, take care, Lee.
I needed a drink. That was lovely. Thank you for the drink. That tea was really nice, actually.
How's that I can help you today?
Well, I'm suffering with a condition, it's Dupuytren, and I've had treatment on it 7 years ago. She did say, I'm very concerned about this hand. It will come back.
Okay.
That hand was more of a problem at the time, but it's already starting to curl.
Bryan has a condition called Dupuytren's contracture, which is where some of the tissue on the front of the hand, on the palm of the hand, basically turns into scar tissue. And what that means is the tendons in the hand get shorter, which means the fingers become permanently bent. And that means it makes it much harder to be able to use the hand normally.
Now, I need my hands for my job.
Yes.
I'm a hairdresser, I'm a salon owner.
Okay.
Still working, and even though I only work part-time,
you need your hands.
It can interfere. And I also play a musical instrument and play semi-professionally.
Okay.
So, and that is a big concern.
Absolutely. What is the instrument that you play?
Saxophone.
Okay. So yes, we need to get this sorted.
Okay. I have prostate cancer, which is advanced, which is secondary cancer. And I'm being managed and have been since late 2015, not long after I had chemo, and they said you're inoperable. And I've got a small tumour on my spine, and it has spread again. It's gone to a lymph node in my groin. They're keeping me good. They've put me on enzalutamide tablets and had radiotherapy in 2020. And basically, they've got me in a good place. One thing that has kept me strong is, through all of this, is my ability to play in a band and play my musical instrument. It's kept me in a very good place mentally.
Okay.
And that means a lot to me.
Absolutely.
And if I lose the ability to play because my fingers, if I leave it and it gets worse and I can't, and she said eventually if it closes in, I won't be able to stretch it out, I'll have to stop playing. I know mentally, if I can't play my instrument, I won't have any sort of focus that takes me away from the health problems that I've got.
You're going to share your biscuit?
I'm going to get me covered in biscuit.
Save it for later.
Zara.
Hiya.
Hi there. Come on through. Hello. All right. Come on in. Come on, have a seat. I'll push that for you.
Thank you.
Who have you brought with you?
This is Paige.
And that's a nice smile. How old is she?
13 months.
13 months. How lovely. Aren't you? What are we talking about today?
So I've come for years and years. I've had problems with like my period pains. I had investigation done like in my early teenage years, and I've just something I've lived with, but it's starting to get progressively worse again, and the pain is affecting whichever side it is, my hip and down my thigh.
Okay.
But I thought I'd come and get checked because I am also under the hospital for leg pain, and I don't know if actually I've had MRIs done and stuff, and it's shown up nothing, and I'm wondering actually is this pain being like referred pain from elsewhere?
Yeah.
So I thought I should probably get checked really.
Okay. So in terms of the heavy periods, let's start right at the beginning. So you haven't had any tests for that recently, but you did back in the day.
Yeah, they said I had a slight thickening of the lining and a tilted uterus, I think.
Which is probably normal.
Yeah,
that bit of it.
and they said that could have been what was causing it.
Okay.
When I had my first son, it kind of stopped for a little bit, and then when I got pregnant again, after having her, it's come back with a vengeance.
Yeah, and in terms of other symptoms, you're getting any discharge or irregular bleeding? Nothing?
No.
You've not been unwell with anything?
No.
That leg pain, where did you have your scan then?
Initially, the MRI was on my knee because I was getting pain in the knee. They said I've got hypermobility, which may have been what was causing it. But I'm at the hospital at the moment. They're looking into my lower back and my hip. But I haven't actually had that scan done yet.
But you're due to?
I think so.
Because it is possible to get gynecological linked pains that spread away from the lower tummy. It's relatively unusual, but not impossible. Would suggest that today that I examine your tummy and your leg and see if I can piece together whether there's anything linked there.
Fine. Just what should I do with her, really?
Well, I'm totally happy if you put her on the floor. If you want to
No, she'll be all
hop
right.
up on the couch.
Hopefully
or if
she doesn't
you want...
get into mischief. That's
So if you just lie yourself flat on your back, and if you could just undo your top button on your jeans.
Yeah, sure.
And then... Oh! Shall I leave that open so she can see you?
You can do.
She just looked a little worried.
National Health have been brilliant with me, but and this seems like a minor complaint considering what I've been through, but
we absolutely need to get it done for you.
Yeah, you can see how it goes.
Absolutely.
She said that may need to be operated on later.
Absolutely, yes. They're certainly looking that way.
Unfortunately, the treatments for it are a bit limited, so physiotherapy can help to try and help stretch the tendons out. But ultimately, it's a condition that usually gets worse over time, and then the only real treatment is to have surgery.
With either hand, can you just put them on the table? I just want to see how flat you can get it. So, OK, and the other one? Yeah, so that one's better, isn't it? But,
yeah, I think that could be done under a local, but I think that's going to cause problems.
Absolutely, that's a call for the specialist who we'll get you to. But absolutely, we'll get you referred to the hand specialists, and they can have a look at it and then work out what the best thing to do for it is to, like you said, you need to keep your hands functioning as well as they can for
my work,
and for your saxophone playing. Yeah,
that is great.
So what I'm going to do is just have a feel of your tummy.
Yeah.
So if I press down at the bottom bit of your tummy...
That's a bit tender there.
Sore there.
But this pain did start yesterday.
And can I just press here on your hip? That's not sore, and not here on the top?
No.
And on the sides?
No.
It's all OK? I'm just going to get you to... It's OK. Just cough.
It's all right, darling.
OK. And it's all right. Do you want to come in here?
Sorry.
Just bend everything up. I know I'm taking it right to the limit, but it's not actually bringing anything on. OK, hop yourself up. We're done. It's fine.
Right, bless.
It's all a bit much, isn't it? All
Bless
a bit much.
OK, that's enough. Calm down. Calm yourself down.
So, I mean, it's a bit sore down at the bottom bit of your tummy.
Yeah.
I can't feel anything that's obvious there. I think the next step is let's book you for an internal and check inside and do the swabs.
Yeah.
That's the next thing. Book us
Great.
an ultrasound scan. That'll be an internal scan to check
Yeah.
the womb and have a look at the ovaries.
Yeah.
I think that's something that we should do again, and we'll get a blood test to check hormone levels and make sure that they're OK, and we can check your full blood count and make sure that you haven't lost a lot of blood along the way if you're bleeding heavily.
Yeah, that's fine.
Does that sound OK?
Yeah, brilliant.
And then once we've got everything, we'll book you back in for the further examination.
Yeah,
if you're
that's
all right
fine.
with that.
And thank you very
All right,
much.
nice to see you.
Thank you.
Thanks then, Paige.
Thank you.
Nice to see you.
Thanks very much. Bye.
Bye. Bye then.
Thank you.
Hello.
Hello.
Hi, come
Hello.
on in. I'm Dr. Gray.
Nice to meet you.
Nice to meet you too.
Yeah, all right, here we go.
You're not from around these parts.
Well, I am, yes.
Yeah,
I've
your
lived,
accent seems...
I've lived here 65 years.
fantastic. And you've still got your Irish accent.
You recognise it then, yes?
I
Yes,
do
yes,
indeed.
yeah. County Tyrone.
My family are from Dublin.
Ah, right, yeah.
How can I help today?
I had a fall about 6 weeks ago, and on this shoulder, and basically I really hurt myself, and I sort of stuck with it for 3 or 4 days, and then eventually I went to A&E and I had it x-rayed, and they said that I hadn't broken anything, but I'm suffering terrible pain. And I can't sleep.
Gosh, 6 weeks of not sleeping must be very tough.
It's all right during the day. It's bad. It's a silly thing, really, because I had this problem about 20 years ago, for which I had an operation. It's like a repetitive strain injury. I just damaged my shoulder then. I had an operation from it, and then I suffered 2 years of absolute hell pain before I had the operation.
Was it on the same side?
Same side. But I've got this sort of throbbing pain in the arm.
So how does it affect you during the day? At night it's keeping you
It doesn't
up?
bother me during the day. I'm fine during the day. I'm aware of it. It's sore. But at night it's driving me crazy. Yeah. Sorry.
Don't apologise. It's okay.
What do you do by way of hobbies?
Music.
What do you play?
Drums.
Great. I'm sure you've got... Have you got understanding neighbours?
1, 2. I go ballroom dancing 3 times a week with my partner.
Wow, okay. With the dancing, if it's sudden movements, it might flare it up, so be a bit careful.
I'm better than you.
I'm a knitter, mainly toys, dolls. I've got so many orders for Christmas.
Oh,
and that
fantastic.
is driving me potty.
We'll keep you playing golf, and hopefully we'll get you playing golf.
Well, I'm playing on Wednesday. I'll see how Wednesday go. If it doesn't go very well, I'll have to take Thursday off then.
I've got a bit of pain in my elbow.
Okay.
And people say, oh, that's tennis elbow.
So can you feel that this is 100%. There's another one called golfer's elbow, and people normally don't play golf, they get it.
I sincerely hope we can keep you playing as long as possible. So you look incredibly well for 74, so, you know, I'm sure the golf is helping with that.
Would you believe this time again? Playing tennis, I did it again. I fell playing tennis with a 7-year-old.
Can you tell me how you fell?
I just fell straight on my shoulder, straight on the edge of my shoulder there, yeah.
Do you mind if we have a look at your shoulder today?
No,
Would that be all right? Would you mind popping off your jacket and in your shirt?
Yeah,
I'm afraid
fine.
it's not very warm in here. It must be hard getting your shirt on and off with that pain. Okay.
Just there.
Just there.
Just
so you're
there.
pointing it's in the front here.
Yeah,
Any pain at the back or on this
it
part?
tends to be there.
Okay.
There.
I'm just going to I'm going to have a look. That doesn't look right at all. Can you do some movements for me to start with? So can you put your arms, 2 arms...
I can't lift that.
Can you lift them just forward as far as you can go? And how far can you
I
bring that
can't
one
go
up?
further.
Okay, and drop it back down again. How far can you move your shoulders back? Okay, don't push it too much. I don't want you to hurt yourself. Okay, and relax. You can pop your shirt back on again. It's difficult to say exactly compared to someone who wouldn't have had surgery before because your shoulder isn't symmetrical compared to the other side and you have a history with that shoulder. My suspicion is that this is an injury of the muscles that go around the shoulder called the rotator cuff. It can be incredibly painful.
Yeah, it is.
And once that's painful, one of the reasons why you can't move is because it's got all swollen. Normally the muscles sort of slip nicely underneath your shoulder blade and things, but they can't because the muscles are all inflamed and that causes terrible pain. I'm glad that you had an x-ray. I might just get the radiologist to have a second look at it. Particularly where you point to where the pain is. And I think it's great that you're seeing a physio. but you may need to be seen in a special musculoskeletal clinic
That's
where
why
the
I've
physios and
made my phone call this morning.
the orthopaedic team assess you together, see if you could benefit from a steroid injection, whether or not you need surgery, whether or not you need an MRI scan. All of that is going to take a bit of time, and so we need to think about your painkillers. Now, I really think that this codeine medication will help, and I want to explore your concerns about taking something with opiates, because I think that's going to be the best option for you for this pain at night.
What is the danger of being addicted to it?
With this type of medication, it can be addictive, but if you have pain and it's being used to treat pain, you're very unlikely to get addicted in those circumstances. It's going to help you to sleep. The worst thing it causes is constipation, which we can give you something to address. But even if you just took a couple of tablets before you went to sleep, if you're otherwise all right during the day, I think it's going to feel a lot more manageable with a good night's sleep. So we do always give it in small amounts. We give you the lowest, most effective dose. So we start low, we build it up, and we're very cautious with how much we re-prescribe it and make sure someone has got an ongoing condition that needs it.
I'll have to do something, so I'll start.
But in the meantime, you've got your physio on the 5th, and if the sleep isn't getting better, then we will make a different plan when we see you again. But I can really see the impact that this is having on you.
Sorry about that.
Thank you for coming to see us today.
It's nice in here, isn't it?
It's lovely. A bit more flashy than your average doctor's reception.
I'm having my kitchen done and it's going to be all red.
Oh, really? So everything's red?
Yeah, my kettle, my teapot, my toaster. I want my kitchen painted red as well, but my daughter said no, it's too much. And her kitchen is exactly the same.
She's got a red one too?
Yeah, and I said to her, you copied me.
Mary Maguire, hello. So come through and have a seat.
Thank you.
And how can I help you today?
Well, I've had diarrhoea for about 6 weeks and it's very loose. And I've tried different things to stop. But I've cut down a lot of food. I only eat breakfast and then one main meal later on. I'm getting a lot of pains in my stomach as well. And
6 weeks as well?
Yeah. Like years ago, when my daughter was born, 91, I had abnormal cells, you know, on my womb.
Right.
My mum died of cancer of the womb, so it's just playing on my mind, you know, especially with the pain.
Any blood in the poo at all?
No.
And you've got some pains in the tummy as well. Whereabouts is the pain?
Just here.
Is it when you open your bowels or before?
Oh, it's before. I mean, I've got pains now.
Okay, okay. Any weight loss at all?
Yeah.
You've lost some weight as well? Okay, all right. In Mary's case, I was quite concerned because she had persistent diarrhoea for 6 weeks and she also had weight loss. Weight loss is one of the red flag symptoms that we look out for when we're worried about patients with a diagnosis of cancer.
I'd have 3 main meals a day.
Yeah.
Plus little snacks in and out.
Okay. Do you know how much weight you've lost?
Over 2 stone.
Okay, all right. Okay. Would it be all right to examine you?
Yeah, yeah.
Just need to feel your tummy to start with. I think you mentioned that you're worried about cancer.
Yeah.
You haven't had any bleeding, but you have had some weight loss.
Yeah.
I think it's important that we examine the back passage as well. It involves inserting a gloved finger into the back passage to feel if there's any lumps or see if there's any blood, so any abnormality that way. Do you want another person, another doctor to come in when I do that? Are you happy for me to examine you? Okay. I'm going to get you to lie down on here.
Yeah.
Yeah, I've got a step there if you need it. Okay. Is your head all right there?
Yeah.
Okay, let's have a look at your tummy then. Is it lower down in the tummy, the pain, or is it all over?
It's just mainly
in
here.
the middle.
Yeah. Oh.
Tender?
Yeah.
So it's lower tenderness there, isn't it? And a little bit here into the middle. Okay, all right. I'm going to pop this down. So I'm just going to have a look at the area just to see if there's any redness or soreness there to start with. Okay. Okay, and I've got some cold gel on a gloved finger, okay?
Yeah, fine,
Take a deep breath in. Sorry.
Oh.
Okay, that's fine. So there's no blood there. Come and have a seat when you're ready.
Thank you.
Do you need a hand sitting up? Are you okay?
No, I'll be all right, love, thank you.
Okay, that's fine, thank you. Come and have a seat. Okay, so from feeling your tummy, you're a little bit tender in the middle, and you've got a bit more tenderness a bit lower down on one side there, on the left, haven't you? The back passage examination feels okay, and there's no blood there that I can see at all, and I can't feel any lumps.
Yeah.
However, you've had 6 weeks now of the diarrhoea once a day.
Yeah.
You mentioned cancer was something that you've got a family history
Yeah.
of, and I think that we do need to refer you on a cancer pathway to make sure it isn't something like a bowel cancer. It might be that this is just an inflamed bowel, or there's an infection that's causing the symptoms. So I think we also need to do some blood tests and send a sample of the poo to the lab to make sure there isn't an infection. But the cancer referral that we need to do is something that we do within 2 weeks, so it's an urgent cancer 2-week wait referral.
Okay.
Yeah, anything else you want to ask me at all? No.
Do you think it's cancer?
I think it's very difficult to say because lots of things can cause diarrhoea that's, persistent. Sometimes inflammation in the bowels can cause it. Things like, I don't know if you've heard of diverticulitis or inflammatory bowel conditions. Sometimes stress can even cause it as well. It might be that it isn't cancer at all, but we can't risk just leaving that and waiting to see.
So it is the best to find out one way or the other.
I think, exactly, because if it is something, then hopefully we're going to catch it early and be able to treat that as well. So I'm glad you came in for it and didn't leave it alone.
Okay.
We'll take things from there and then we'll see you back in a couple of weeks when you've had that appointment.
Yeah. Thank you very much, Doctor.
That's all right. You take care.
You've eased my mind.
Oh, take care. Bye-bye.
Thank you.
Sorry.
It's all right. Don't apologise.
You're frightened to cough anymore, aren't you? Can't think you got COVID.
I know. Oh, yeah. Everybody sneezes and you die, don't you?
I know.
Did you get COVID at all?
No.
You're lucky then.
I was really lucky, yeah, I never got it.
I had it, quite ill with it as well.
Oh, wow.
But, you survived, don't you?
Hello. Hi, come on through.
Thank you.
Come and have a seat. You
Nice
look
to see you
better,
again.
don't you?
Yeah.
Come and have a seat.
Yeah.
So how
I
is
didn't
the
realise how
chest?
much I was struggling before.
Yeah.
Yeah. It's still a bit crackly and I keep coughing, but like breathing is a lot better.
You sound, just sitting there, you sound less wheezy than you did.
Yeah, as I say, it was quite intense on Monday.
Caroline came to see me with a flare-up of her asthma, and actually she was quite unwell with it, and she wasn't sure when she should be seeking help for her asthma. How often are you taking your Ventolin at the moment?
Because I sometimes still getting out of breath. I've took it about 3 times over like yesterday.
Yeah. When Caroline went away from our appointment and she needed some steroid medications, I wrote up a special asthma action plan for her with some individualised numbers of what to expect on her peak flow reading and what things to look out for. Okay. But I wanted to see what your peak flow is looking like now and have a listen to your chest.
Yeah.
Is that all right?
Yeah, that's fine.
Let's start off with your oxygen levels. Yeah, so most people should have a level over 95, but certainly with what we learned with COVID, was 91 was a real kind of danger point. I don't think that's right, actually, because you don't look like your oxygen levels are 80.
No.
Your hands are nice and warm. Let's have a listen.
Okay.
Would you mind humming around here? Because you've got to make sure all of these little numbers and things all give us a little bit of a picture of what's going on.
Yeah.
Right, let's have a listen at the back to start with. Okay, so nice deep breaths in and out. And then just breathe normally for a minute. That's fine. Yeah.
Sorry.
No worries. Come and have a seat. Your lungs still sound pretty dreadful, to be honest. Before you sit down, let's get you doing this. Just do the best you can on it.
Okay.
I can see you're putting good effort into that. It's 220. So, you feel better, all your numbers are looking worse.
I'm still taking the steroids.
Yeah. I am surprised that you're not better after the steroids. I wonder if we get someone to check you over this afternoon.
Yeah.
At the hospital in terms of doing a chest x-ray, getting some bloods done, maybe giving you a nebulizer and just seeing if they can get... I'm not saying that you'd necessarily be admitted, but I would expect 3 days after being on high-dose steroids for you to be a lot better than you are today.
Yeah.
And one of the reasons why we get people back in is to check things are going in the right direction because actually asthma can be quite serious when you have a flare-up.
now do a deep breath in and out. And again.
Sorry, my fingers are freezing. Deep breaths.
Did you ever have asthma when you were younger?
I might have had it slightly.
Yeah.
Her doctors has tried everything and now they are suspecting that it might be asthma.
Like that.
Okay, is there any family history of asthma?
We don't have family history.
You mentioned that you'd tried an inhaler in the past.
I don't seem to get that much relief from it. I've done the peak flow test recently.
Okay, that's not too bad, isn't it? I'll give it one more go.
I would actually like you to be
No,
seen
that's
in hospital
fine.
today. Is
Yeah,
that okay?
that's fine.
I've brought a nebulizer in so that we can, before you go, just give you a chance to open things up as much as possible, and that must make the journey a bit easier.
That'd be brilliant.
If you put that just across your nose and mouth, that's it. Are you comfortable there?
Yeah, that's fine.
And I'm going to turn it on and just leave you to sit here and breathe comfortably for a few minutes, okay? That's working beautifully, and just breathe nice and gently. When it's all finished, I'm going to come back, have a look at you again, all right? I'll be back shortly. Is that okay?
Hello.
Hello. I brought back the asthmatic patient I saw on Monday for a review. Her obs are all worse.
Oh.
So I've made a decision she needs to be seen in hospital this evening.
Yeah.
If asthma goes on untreated and someone does end up in hospital with it, they can get very unwell very quickly. So they'll need oxygen, they need special medication that they inhale. Sometimes they also need medication in through the vein, and asthma can be a life-threatening condition. Looks clear now? Yeah. I'm going to check you over one more time. And I'll turn it off. All right, so there you go.
Done this one?
Yeah. Hasn't done anything to your oxygen levels, so that's why I think you do need to be seen.
Okay.
See your peak flow.
Thank you for all your help.
Not at all. Exactly where it was before. You are at least consistent. Safely home, please.
Yeah.
And then husband.
Definitely, 100%. I will go, definitely.
Yeah.
Thank you.
And then follow up next week when you're better.
Thank you.
Hope
Bye.
You feel better soon.
Hello.
Hello.
Come on in.
Come in.
Have a seat there for me. How are you today?
My knee is kind of biting me.
Yeah? So you've had some pain in this knee for a good long while now, isn't it?
A couple of years, yeah.
A couple of years. And do you have any sense of what sort of caused it, what started it hurting like back at the beginning?
It just started.
Just started.
And it does swell.
And so how have we managed the pain for you over the last couple of years?
Painkillers. It doesn't go away. It's just there.
It's always there.
It's just there.
You're 58 years old, so you're still a young woman. Your knees are going to have to last you a long, long while yet.
Yeah.
And so the point is what is it that we could also be doing alongside managing the pain for you that kind of helps the knee be better for longer? And medically speaking, it's the physiotherapy, it's the exercises.
I do exercise. I mean, the walk up and down, that's enough exercise.
With knee problems particularly, it is very much about the muscles that sit around the knee. And the stronger and better the condition those muscles are in, the less strain the knee ends up under. And so we were thinking about whether we might do a steroid injection into the knee today. What effect does the steroid injection have on the knee?
Well, when I have it, to be honest, for the first 2 weeks, it's agony.
Okay.
And then after that, I forget about it.
All right. I mean, are you pain-free?
Not pain-free, it's there, but it's not as intense.
Okay. So if we do the injection, there's a window of opportunity there. Focus on those exercises in that first couple of months when the pain's not there, then hopefully that might make it even longer, it might keep your knee better for longer. And overall, that's a better position for you to be in, right?
Yeah, definitely. Yeah?
Okay. So, right, come get up on the couch for me. Let's have a better look at your knees.
Okay.
Yeah, lay yourself back. Yeah, so there's definitely a bit of fluid on there. I can tell there's some swelling. What if I press a bit harder like that?
No.
You don't like that at all, do you?
No. That way.
That way. Where does it hurt when I do that?
Well, my hand is.
Where my hand is here. So it's sort of very painful to press around here, isn't it?
Yep. Ow.
Okay, so we've definitely got some swelling in this knee, and that tells me there's something irritated on the inside of that. And when things are irritated inside the knee joint, fluid is produced, and that's what causes the swelling. I'm sorry I caused you a bit of pain there, didn't I? Are you okay?
Yeah, I'm all right, yeah.
All right, okay.
Okay.
All right. You ready?
Ready, zombie.
Just try and keep this leg nice and relaxed. Keep it still for me.
I'll try. Ow! Ow!
Well done.
Oh, that hurts.
Done. Well done. Right, you can have a seat again for a moment. How are you feeling, first of all?
I'm coming down slowly.
Okay, good.
A minute ago it was kind of heavy.
Yeah.
But now, slowly, it is
Slowly. You're free to go.
Okay.
All right, all the best.
Thank you.
Bye-bye.
Bye.
Good boy, well done. You got Yoda there. Yeah. All right, take care then, Mum. All right. Bye, Yoda.
Nice to see you.
Okay, then.
All right,
thank
I hope
you.
that helps.
Bye.
Nice to see you then, Bailey.
Thank you. And enjoy your trip. This sounds fabulous.
All right, and I'll get back to you on
Thanks
the bloods,
a lot.
but we should get those done this week.
Okay, thank you.
Okay,
Thanks,
take care.
bye-bye.
Bye-bye. I feel very lucky to work in general practice. It's a fantastic specialty. Despite the work pressures, I do still really enjoy it.
The best thing about being a GP is that I get to talk to people. I get to find out about their lives, and in some little way I can sometimes help and make their lives a little bit better. And there's no greater feeling in the world when I'm able to do that. There's no quick fixes, unfortunately, is there?
Yeah.
We have to sometimes be comfortable with feeling uncomfortable.
Are you taking anything for pain?
No, I haven't been taking nothing for pain.
Okay. Any particular reason? You're hard.
You okay?
Yeah, just a bit hot.
Okay.